I would explain anaesthesia to non-anaesthetists as anaesthetists ensure that patients are fit for surgery, and we provide care for those patients before, during and after their surgical procedures. We do that through a variety of means, so we can administer general anaesthesia, which renders the whole body unconscious. We can provide regional anaesthesia, which makes just part of the body numb, or sedation, which can just decrease the level of consciousness for a patient to remove pain and sensation. A typical workday for me is varied, and that's one of the things I love about my job. One day I could be in theatre working with a variety of different teams, from neurosurgery to orthopaedics to vascular surgery, and that could be doing elective or acute work. Anaesthetists are also present on pain rounds, so we go around the hospital making sure that patients are receiving adequate analgesia. And we also sit in pre-admission clinics, and that gives us time to have in-depth kōrero with patients in their whānau, talking about their health literacy and helping them to make informed decisions about their care. And we also provide information for them sort of about their upcoming surgery, like what medications they should or shouldn't take. The thing I enjoy most about my job is it's a really interesting mix of knowledge and skills. We get to mix practical skills like line insertions and the provision of regional anaesthesia, as well as balancing physiological changes by using different medications to keep patients safe and comfortable. So how do I relax a nervous patient? I take time to whanaungatanga. Building relationships with patients in their whānau is a really powerful tool. It shows patients that they are important to me as an individual. Patients also find karakia to be quite therapeutic for them, and so allowing them a quiet place and time to do this is also a really important tool. So one of the most common questions that I get asked by patients is, why do they have to stop eating before their surgery? And the reason for this is because under general anaesthesia, a lot of the muscles in the body relax, including the muscles that keep food down into your stomach. So when they go off to sleep, if your stomach is full, there's a risk that those contents can come up and go down into your lungs and cause irritation or inflammation and make it hard for you to breathe. One piece of advice I would give to patients preparing for anaesthesia would be to try to avoid Googling things. If you have questions, please write them down and bring them into your appointment. If you can't resist Googling, please go to a reputable source like the ANZCA website. And the other thing I would say is that it's never too late to give up smoking or start exercising before your surgery date.